Greetings to all our viewers. We welcome you to Matters of Life. Today we are here to discuss about our health, and I believe you are going to be blessed by this program. And without much ado, I want to welcome our mom. Before I welcome our mom here, my name is Mrs. Mary Linda Tediku. I'm your host, and I want you to join me and welcome our mom, who is Mrs. Bertha Asante, coming all the way from London. Mommy, you are welcome. We are grateful to have you on the program.
Thank you so much, Marlinda. Yes, my name is Bertha Asante. I'm a nurse by profession, clinical practice educator for that purpose, and happy to be here with you.
Thank you. Thank you for accepting our invitation. Today, our main topic that we're going to treat is full body MOT.
That's right.
Yeah, and so we'll go on with few questions. When we say body MOT, what does it mean at all?
Thank you so much. As we all know, MOT normally is related to vehicles. It actually stands for Ministry of Transport. It's just routine checks, annual checks that every vehicle needs to go through to be approved as worthy to be on the road. So relating our health to MOT, full body MOT implies checking. The meaning I have given to this MOT is not Ministry of Transport, but M is for maintenance, O is for observation, and T is test. As we go about with our life, it is really important, necessary to check our body. You know, our body comprises of cells, tissues that forms organs and systems, and they go through wear and tear. And it is really important that we check our body. Some of the things are seen. We can see changes in some of the organs and the tissues in our body. But there are some of them that are hidden until we specifically go through checks, and we will not know. So that is what we mean by full body MOT, from head to toe, going through assessment and checking what is going on within our body, so that if there is the need for us to take the step to prevent certain diseases from becoming huge. As we all know, we talk about prevention being better than cure. So we can prevent diseases from reaching the stage that we cannot do anything about it. So that is the reason why it is really important for us as humans to go through body MOT.
Thank you so much. Thank you so much. And how does this MOT differ from a standard medical checkup?
Yes. The standard medical checks normally used to be age 40. NHS will write to individuals, patients on their list, or the people in their surgery, or they invite everyone to come for general checks, assessment, blood tests. Full body MOT deals with more, internal organs like cardiovascular system, respiratory system. There are so many other tests like echocardiogram and electrocardiogram, tests that the general assessment will not add to that. But the full body MOT deals with every aspect of our body to just confirm, not necessarily fishing out diseases, but then just confirming, ruling out problems, and then confirming that yes, your cardiovascular system is working all right, your respiratory system is okay, your genitourinary system is okay. So ruling out, and then you feel comfortable knowing that the system is okay within your body. So that is what we mean by the full body MOT goes deeper than the general health assessment.
So it doesn't matter whether you are healthy or you are not, you have to go under this MOT you're talking about.
That's right. That's right. It's very important. We should not just feel sick before we go for the MOT, because it's not everything that we can see or feel it in our body. Certain things happen within our body that needs assessment, specific tests, blood tests, and other assessment to actually review what is going on within the body. So we don't have to wait to feel sick before we go through this MOT.
Thank you so much. What is the key components are included in the comprehensive full body check?
Yes. Comprehensive full body checks deals with the vital signs. They will check basic things like blood tests that will look for sugar, blood sugar. You know, we have the general assessment. I deal with the pricks, with checking blood sugar. But these deals, they take blood to check the various components within the blood, knowing the levels, whether it is going higher or lower, blood sugar, lipids. You know, it deals with cardiovascular assessment, imaging scans, cancer screenings, musculoskeletal and joint assessment, respiratory function tests. So the components are a lot. It deals with, basically, I should say, all the systems in our body, the respiratory system, cardiovascular system, even muscles, muscle tone. There are things that they check for us to know that though we see things on the outside as good, there might be certain components within the body that need attention. Yeah.
Thank you so much for that. Yeah. How can a full body MOT help in the early detection and prevention of chronic disease?
Okay, that's right. What happens is that the MOT, as we have already discussed, takes into consideration tests and assessment, which the results might determine whether somebody is developing a particular illness or disease. And early detection, always something can be done about it. Example is like the PSA of men. You know, we know the statistics are shown that if you put 1 in 8 in general, men, 1 in 8 will get prostate cancer. But if you take the Afro men, 1 in 4, it's prevalent in people of color. Therefore, when someone checks the PSA early enough to know the level that is going up, that's the prostate, the function, the PSA, what's the full name? We have to edit something. If they check and they realize the level, that will determine whether it is within normal or something needs to be done about it. So every test that is done, the results will suggest whether things are okay or something needs amendment or some treatment. It needs proper treatment or amendment to prevent huge diseases from occurring. So it is very important that we don't wait for things to start before we do something about it. But general checks will suggest whether a disease is developing or things are okay. That is why we say prevention is better than cure.
Thank you so much for that. Yeah, thank you. So, what specific health metric or detector are most common assessed during full body check or MOT?
Yeah, blood pressure and heart rate is common. That one is done normally with a routine visits to the GP. Blood glucose levels, cholesterol levels, the body mass index. There are times we look at somebody and we suggest that, oh, this person looks healthy, but it does not always relate. The body, somebody's physique does not always tell that they are healthy or not. But then checking the body mass index in the putting the height and the size, the weight, the age of the individual in consideration to suggest if they are healthy or they need to pay attention to something. Organ function test, bone density, it all comes in. So it deals with the general health or the general body. So those are basic assessment, vital signs of blood pressure comes. It's also very important. It sounds very simple, but we all know that hypertension is a silent killer. Somebody might be moving about, going about their daily routine normally, but for all they know, their blood pressure has really gone so high that they might just drop dead. But if they check regularly and they realize that their blood pressure or their heart rate has gone up, then they can be put on medication, or lifestyle changes can sort it in one way or the other.
Excellent. Thank you. Thank you. Yeah. So, can you explain the preparation steps someone should take before going for a full body MOT?
Yeah. Some of these few things, if they are not specifically requested and the person is taking a step to go for general full body MOT, it's advisable to keep hydration, hydrate themselves. It helps with most of the tests, checking bladder scans, and a lot of tests, even blood tests. If somebody is hydrated, it's easier to be able to get blood from them. If they are dehydrated, it's quite challenging taking blood from a dehydrated person. And then fasting, 6 hours, around 6 hours fasting. So depending on the time appointment that has been given, it is always helpful to have empty stomach before going for the assessment, because it helps get a clearer level of some of the tests that are done. Wearing comfortable clothing, because they will take blood pressure. If it's like cold and you've worn tight, thick pullovers and stuff like that, then you go and you have to be removing your clothes here and there. So maybe having a thicker jacket on, but the inner ones should be clothes that are loose enough that if they want to take blood pressure, or they want to reach a vessel or a tone of the knee, sometimes the auscultations and other tests they do. So it's advisable to wear clothes that can easily be give way for assessment of the various parts of the body. Yeah, hydration, and then medical history. If there are medications, it's very important. If they are not known, cannot be mentioned offhand, then there should be a record of medications that the individual is taking. It's very important, because that can help to make a decision on the level of the individual's condition. So having medication, avoiding caffeine and alcohol is also important. Those who take alcohol and drink a lot of coffee, it is important to stay away from that on the day that they're going for the checks.
Okay.
That's right.
All right. Thank you. Thank you so much. So, how often can we do this test? This test monthly, 6 months, 1 year.
Yeah.
How often can we frequently can we?
It depends. It depends. Ideally, it's like annually. Some tests, like we have this smear test that is done every 3 years.
3 years, yeah.
So it depends. If all is well and you've done one and the recordings or the levels that are found are perfect, no concerns, no issues, that the individual has not been put on any medication or anything of such sort, there's no need doing it regularly. So it's kind of annually, but it depends on which type of test. Some of the tests too, they are expensive. So in as much as our health is very important to us, if it is expensive and you've done the test and there's no concern, there's no need, the doctor can be of great help. The medical personnel who will assess, interpret the results of the test, will give advice on when the individual needs to retest again. Okay. But you know, some certain things like blood pressure can be tested or can be checked as regular as possible. Blood sugar and other things can be tested. But definitely it is good to be asking questions when we are there with the medics, and they can be of good help depending on the outcome or the results they've got from our MOT checks. Then they will advise us when next we are due
to come again.
Yeah.
Thank you so much. Yeah. What are the common outcome of a full body MOT, and how should individuals interpret their results?
Yeah, definitely the interpretation will be done by the medic. There are normal results, there are borderline results, there are abnormal results, you know. And the normal results indicate that the person is in good health and there are no concerns. Right. There are borderline ones. Sometimes, you know, the blood sugar. That is the common one that is done regularly, even from the general assessment. Blood sugar, blood pressure, and blood cholesterol. And normally, a lot of people will be in the borderline one. Then one is advised that lifestyle changes can improve on it, or medication. So if the individual is ready to go through lifestyle changes, there are actually clinics that support the individuals. I have been on such clinics before. You know, I was quite upset when I was told blood sugar is borderline, so you might develop diabetes, and I'm thinking, I don't take sugar. But you know, another time we will talk about some of these things. Even the fruits, I eat a lot of fruits on empty stomach, lots of fruits, and that can be our downfall when we think we are improving our diet. Eating a lot of grapes, strawberry, bananas, a lot of them, sometimes about 6 or 7 of them in the morning on empty. There's a lot of sugar in there. So I thought I was eating healthy, but that was my downfall. So being on the borderline, they will advise lifestyle changes that can help to reduce, bring you from the borderline to the normal range, or medications, or knowing the consequences, like blood pressure too. If somebody is on the borderline, the medics will advise on how someone can stay, maybe staying away from coffee and other things, stressful situations, and exercises, anything that will help, and the type of diet that clogs our arteries, and fluid hydration also help a lot in building the blood in a way that it's not very thick to be pushed, increase the pressure that moves it. So they advise on how we can work on borderline levels. But if it is gone past borderline, it's abnormal results, then depending on what it is, either the person is put on medication or becomes a regular patient for tests. I won't say patient, but then they will put the individual on a plan how often they should be checking. Even blood pressure, sometimes one is advised to buy blood pressure monitor and keep her home to be checking regularly and stuff like that. So it depends on the results, and it depends on other conditions put together, and then the medics will make a decision to put on lifestyle changes, medications, or regular checks.
Thank you for that. Thank you so much for that. So what should one do if their full body MOT uncovers expected health issues?
Right. Luckily for us in the UK here, we have the NHS, and normally we do a lot of these through the NHS, and the doctors are there to advise us. Well, when they tell us about the results, we have to keep calm. You know, others also have their checks in the private sector. Because NHS, sometimes we know that you can join a long queue, waiting list, and the rest. So if you sort out from the private, at times it's advisable that because our records, our general records are kept with the NHS team, our GP surgeries and the rest, we take the results, bring it to our general practitioner who knows us very well and have all our record, for them to look at our medical history, past surgical history, and other things, put it all together, family history, that record they have, and then they bring the results in and then put it all together to interpret. So we don't have to be scared when we are told, oh, this is on borderline, or this is within the abnormal range. We have to relax, keep calm, and as soon as possible, bring the report to our surgery and see our general practitioner to help us make a decision to know the best thing that we can do going forward. Because when we become scared, it worsens things. Sometimes, being scared and being nervous and being emotional about our results can even worsen things. The reason why sometimes children are able to escape these things when they don't know it, they don't understand, they don't take it too serious. The treatment goes on. But for adults, and especially medics, are the worst offenders. Once we get a tiny diagnosis, we are so scared and we begin to think about what next and what can happen. And obviously it becomes worse when we begin to think about it. So we need to keep calm, consult our doctor for them to help us to make a decision on that, and then follow up recommendations. Because definitely no doctor, whether private or NHS, will find out about abnormal or borderline results and leave the individual that this is on borderline, this is on borderline, this is abnormal, and give you your results. You might get hit by a car by thinking too much on your way. They definitely will guide. So recommendations that are given, we have to follow them and do not feel like, no, definitely not me. Sometimes we spiritualize things. Obviously not me. Like when I was told borderline diabetes, borderline, I said, of course, not me. I eat well. I don't look it. But it doesn't work that way. We are flesh and blood, and anything can happen to the body. In as much as the Lord is with us and protect us, He's giving us wisdom, and He's giving wisdom to the medics to deal with these things. We have to accept it and then follow advice and recommendations and work at what the guidelines are given. And the Lord will also, once the medics do their treatment, then the Lord will add the healing onto it for us to gain our health. Amen.
Amen. Thank you so much for that. Thank you so much. Are there any misconceptions about full body MOT that people should be aware of?
Yeah, there are some misconceptions. Like some people think it's for the old ones, I look strong, I'm okay, I don't need it. sometimes we get advice that how long ago did you have body MOT or checks? No, I haven't had one. People really brag about it. I've never seen a doctor. I've never, for 20 years, I've not seen a medical practitioner. But, well, it's good you are not sick. However, seeing a medical practitioner is not good that one has not seen one. So the misconception is that it's only for the old ones. But no, it can be for anyone. Now, from record, a lot of diseases that used to happen most predominantly to the old ones now it's becoming rampant with the younger ones as well. Anything can happen to anybody. So that's it. And then one test or one assessment does not deal with everything. That's one misconception that, well, I have been one, so I'm also done. I'm okay. No, we shouldn't frown upon regular ones once it is recommended. We should realize that frequent and as often as it's been recommended, we need to follow it.
Thank you so much.
Sorry, another one too is that if I'm not sick, I don't need it. We just want to see something. And some of the things, before you see it, you are already in your grave. Like hypertension, which is a silent killer. If you're waiting to get hypertension before you check your blood pressure, if you are not careful, by the time you notice it, you've just dropped dead. So it is not only the sick and the disease that does the checks. Everyone is supposed to do it.
Everyone, thank you so much. Before we conclude, what lifestyle or habit can help us individually to, not go through this? What lifestyle
Health issues and
habits?
I think we all are aware the importance is doing it. One of it is healthy diet, balanced diet, eating healthy food. It was easier some years ago that when we talk about healthy food, fruits, vegetables, more of vegetables and fruits, and then less carbohydrates and protein, the best of protein, not the fatty ones and the rest. It was easy saying it. But we are now in an era that even the fruits and using pesticides and insecticides and preservatives, some of the foods are transported or from some far, and they've got all sorts of things on there. So we need to be mindful of what we take in our diet, not eating too much of food that are made from plants, processed foods. Cut down, or better still, stay away from processed foods and eat more of natural plant-based foods, vegetables more. It's very important. And then we need to have enough sleep and rest. Sleep is different from rest. Some people will sleep, but because of too much thinking, they are not resting. The mind is active, going through a lot, even in the night when they are sleeping. So having a sound sleep, and then sometimes in the afternoon resting, even 45 minutes rest in the afternoon, relaxing is very, very important. Then exercise, not leading sedentary life, sitting there and calling the children, give me remote, doing the... We need to be active, walk, making regular walking, brisk walking part of our lifestyle. It's a form of exercise. So exercise, good dieting, good rest, it all comes together. And then mind, staying away from stress and not keeping things in our hearts too much to stress us, forgiving easily to free our mind, and then staying away from stress also help us to maintain healthy life in between these checks, to make sure that we are not causing trouble to our body before then we are due again for another check.
Thank you so much. In our conclusion, I just want to ask, I think many people don't go for this test because they prefer not to,
No.
know that this is happening to me. You have this, you have that, and they think that the fear alone can kill them. What can you say in conclusion, even as we are bringing it to an end? What can you say about that?
Thank
You have
you
already
so
said
much.
that prevention is better than cure. So,
Yeah.
especially our men.
Thank you for saying this. Yeah, it's one of the misconception as well. That, well, if I don't know, then I don't know. Then it's not going to stress me or it's not going to affect me. But hey, if you don't know, it might be eating deeper into you. If you don't know the results, if you don't know, if you haven't gone for this breast assessment check for it to be detected that maybe there is a growth somewhere. Sometimes they just have a like lumpectomy. If there is a tiny lump growing, they can remove it and that might solve the problem. But if you don't realize it, if you don't check it, mammogram or other things, you don't know it is becoming huge, bigger and spreading. By the time they realize, it might be at the stage that nothing can be done about it. So I would say it can be daunting when you are told these things, but it's better to detect it and then free your mind and follow the guidelines and things will work out. Prevention is better than cure. Thank you.
Excellent. Thank you so much, Mommy, for being with us today and teaching us through all these things. I believe we are learning a lot that will help us to go a long way. We want to thank you for accepting our invitation to come and bless us with all this. God bless you so much. We are grateful to have you.
God bless you too.
Okay.
Thank you.
This is how far we can bring our program. We want to thank you, all viewers. I believe you have learned a lot. Prevention is better than cure. Don't sit till it gets worse. Check, have a MOT check, whether 6 months, whether yearly, and I believe it will help you to keep your body in full health. God bless you, and I believe you are blessed. If you are blessed with this program, please share it so that others can be blessed. See you in our other next episode. God bless you.